Okay, today I'm going to be going over my patient Bernice. She's a 60-year-old woman who has a moderately severe to profound sloping sensorial hearing loss in both ears. She's been using hearing aids for the past 5 or 6 years, but still struggles with communicating. She reports she frequently has to ask people to repeat themselves. She has a hard time talking on the phone, and she doesn't understand what those around her are saying. She feels like she doesn't get a lot of benefit from hearing aids. So, this is Bernice, our patient for today. I will also be using this to communicate with her very clearly, as making sure she's right across from me to see my mouth to give the best communication possible. Okay, hi Bernice. So you've had your testing done, or you've had your hearing tested before, and you've been wearing hearing aids for quite a bit. So I'm sure you're familiar with an audiogram, but real quick, I'm just going to go over with it just to make sure you are familiar. So this is how we measured your hearing capabilities today. Across the top, we have pitch, low to high, like a piano, and on the side here, we have volume from low to high. Basically how loud I had to play things for you to just barely hear them, okay? In this range up here from about 5 to 25 is where we classify normal hearing. So as you can see, we had to make this quite a bit louder just so that you could barely hear them, okay? We also did some word testing today. And what I was doing with that testing was to see how well you understood speech without your hearing aids. And I'm sure you know that was pretty difficult for you. And you were only able to tell me the right words about 40% of the time. So with all of that information out there, I know you've been struggling a lot with your hearing aids on understanding people, and you have to ask them to repeat themselves quite a bit. So based on your degree of hearing loss and what you've communicated with me and your lack of success with the hearing aids thus far, I think we should discuss doing a cochlear implant. Have you heard of those before? Okay, so a cochlear implant is a little bit different than a hearing aid. Well, it's a lot of it different. So a hearing aid's job is essentially just to amplify. It's going to make things louder for you. Its job is to take sound from the world. It comes into the hearing aid and it just makes it louder. But there's a limit to that. So we can make sound loud enough, but like in your case, you can still have trouble understanding speech or what people are saying, okay? So cochlear implant is going to pick up that sound and change it from acoustic energy to electric energy. So instead of making it louder, we're bypassing that whole system of the ear, and we're electrically stimulating the brain to interpret that sound instead. So a cochlear implant has two parts to it. There's an internal part that has a coil in it that receives signals from the external part, and it sends them down to this receiver and lead into what we call an electrode ray that sits in your inner ear. Like that picture you've seen before, we call that the cochlea. That's where this electrode array is going to sit. And that's what stimulates the auditory nerve and allow your brain to hear those signals by stimulating it in that way instead of acoustically. There's also the external part. So this piece kind of looks similar to the hearing aid that you have. So it sits over your ear as well. And a lot of those pieces, a lot of parts on this piece you're familiar with. There are the microphones and the bottom where the battery goes in. But what's really different from this, from your hearing aid, at least looks wise, is this magnetic portion. And the cable connecting to it. So that's what's sending those signals from the part over your ear to the internal part that we talked about earlier. So this does include a surgery. So surgery is done under general anesthesia, and what they do is create a small incision behind the ear and make a small place for the electrode to come in through the bone and go into the cochlea, or that inner ear part we talked about just a second ago. The receiver portion is then going to be placed just underneath the skin, and then they stitch you back up, and that's it. You're pretty straightforward there, and you should be able to leave the same day. So it's a very quick in and out thing. The surgery usually only takes a few hours. One of the biggest questions people have are about insurance and cost. So cochlear implants are considered a medical necessity treatment for significant hearing loss, like one that you have. So they're often covered by many insurance plans like Medicare, Medicaid, and private insurers. That being said, every plan's a little bit different, so we try to verify specific benefits before the surgery. So the cost can really vary, but if this is the route that we decide to go with for you, and it's my opinion that that's what would be best, we can figure all of that out before anything gets planned or anything is done. We just need to decide, like, this is what we're working towards, what we're doing. Another thing people have a lot of questions about are their responsibility and expectations with the device. So what I would want you to wear the processor about at least 12 hours a day after your surgery. So when using a cochlear implant, what we're doing is we're giving the brain a new way to hear, and that takes time and it takes consistency. So it's really important that you wear it as much as possible, not when you sleep or when you shower, kind of like with your hearing aid, but just about every other time, I want you to be wearing it. There's also the conversation of follow-up appointments and programming and all of that. So after surgery, in about a week or 2 weeks, we'll want you to come in, we'll activate the device and do some basic programming to get you going. Then about a month after that, we'll check in, we'll see how things are going, we'll adjust as needed. And at that point, we can do a 3 or 6 month follow-up depending on how you're doing and what your needs are. And from that point on, as long as everything is where it needs to be, we should be on a yearly to biannual visiting schedule. So you won't have to come and see me as often as long as everything is going well and to be expected. On that note, some outcomes I would expect for you would be a definite improvement in performance compared to the hearing aid. I would expect you to have an easier time talking and participating in complex environments, and definitely have an easier time talking on the phone. And I would expect those improvements to happen gradually over the first 6 months to a year in best case scenario. And of course, all of that depends on how often you're using the processor and exposing yourself to all of those environments. So back to those expectations of what you as a patient would need to do, like your responsibility would be wearing it consistently. So now that I've given you all that information, how do you feel about moving forward with a cochlear implant?